It is now my distinct honor and pleasure to introduce Dr. Dushanka Kleinman, who will deliver our 2012 Commencement Keynote Address. Dr. Kleinman is a proud alum, having earned her certificate in advanced graduate study and Masters of Science in Dentistry and Dental Public Health at the Henry M. Goldman School of Dental Medicine. Prior to attending the Henry M. Goldman School of Dental Medicine, she earned a Bachelor of Science in Zoology from the University of Wisconsin and a DDS from the College of Dentistry at the University of Illinois at Chicago, followed by a dental internship at the University of Chicago Hospitals and Clinics. Dr. Kleinman presently serves as Associate Dean for Research and Professor, Department of Epidemiology and Biostatistics, School of Public Health, University of Maryland at College Park. In this role, she works closely with the school's senior leadership, faculty, and students, and has developed much of the past few years to the initial accreditation of this new School of Public Health. Prior to joining the University of Maryland in 2007, Dr. Kleinman completed 28 years of government service, where she most recently served as Deputy Director, National Institute of Dental and Craniofacial Research, National Institutes of Health, and Assistant Surgeon General, United States Public Health Service Commission Corps. In 2006, she also completed a 5-year term as the 15th Chief Dental Officer, U.S. Public Health Service. At National Institutes of Health, Dr. Kleinman assumed the role of NIDCR Acting Director twice during transitions between directors. She coordinated the federal involvement in the development of the first-ever Surgeon General's report on oral health in 2000 and served as the first Assistant Director of the NIH Roadmap for Medical Research. She also holds the rank of Rear Admiral Retired, U.S. Public Health Service. Dr. Kleinman is a diplomate of the American Board of Dental Public Health and has served as president of several organizations, including the American Board of Dental Public Health, the American Association of Women Dentists, and the American Association of Public Health Dentistry. Her work on the epidemiology of oral mucosal tissue diseases and disorders and related activities has been recognized by multiple organizations. In addition to her School of Public Health responsibilities, she currently serves on the editorial board of the Journal of the American Dental Association and is a board member of several organizations and foundations, including the Public Health Service Commissioned Officers Foundation. Dr. Kleinman is a superlative example of the successful and public-minded dentist we strive to graduate from the Henry M. Goldman School of Dental Medicine. It is indeed an honor and a privilege to welcome Dr. Dushanka Kleinman to the podium to deliver the 2012 Henry M. Goldman School of Dental Medicine Commencement Address. Please join me in a round of applause.
It is wonderful to be here to join you today. And I see we have a cheerleader right up front. Good afternoon, Dean Hutter, distinguished faculty and guests, families and friends, and most importantly, 2012 graduates. I'm just thrilled to join you today. Congratulations to those being honored today. And to the families, I know how you feel. My husband and I have had the good fortune of sitting through several graduations with our daughters. Graduates, occasions like this are one of the defining moments of life, and moments when we come together to witness and celebrate. In fact, today is a three-part celebration, as we've heard. One is a recognition of your accomplishments. Second, it's a commemoration of good things to come that you will give us. And very importantly, today's a celebration of the support provided to you by family, friends, faculty, and staff. And I'm excited to be joining you today, coming home to this incredible school. It's a school whose foundation was built on its commitment to global and local communities. And it's a school with the faculty who have been on the cutting edge and continue in research, in teaching, and in service. And I recall the excitement that I had when I came here in 1974, a long time ago, and the humidity of that summer. The school was the Henry M. Goldman School of Graduate Dentistry. The pre-doctoral program had just begun a few years earlier. It was just 6 years since the passage of the Massachusetts fluoridation law, and this school was embarking on a dental public health program under the leadership of my mentor, Anthony Westwater Jong. It was an exciting time. We were sent and immersed in every aspect of public health, in school-based and community health clinics, in emerging group practices at that time. We were involved in briefing state legislators on the benefits of fluoridation. We worked with the Massachusetts Coalition for Better Dental Health, and we participated in hospital rounds and more. And this school opened the door to the full university's offerings, provided the freedom for ideas and passion for life's work, and created the incredible environment for interdisciplinary, interprofessional, international education, thinking, and work, long before this was fashionable. This school was far ahead of others in nurturing and practicing these now highly sought-after attributes of higher education, and it is still far ahead. Having lived in 3 countries, and as a brand new US citizen at that time, it was a welcome homecoming to be here, and as we've heard, here as a microcosm of the world, both on and beyond the university campus. And of course, from a very personal perspective, coming to Boston was also home creating for me. My husband and I were married on the BU campus and the castle shortly after we arrived here. But my experience was decades ago, and I know these attributes of the school and university that I experienced are not new to you. With your faculty and the programs, you've experienced much more, and in a city and a state that's been unique in healthcare and in healthcare reform. And from what I've learned, you've taken good advantage of your time here, and you're adding to the legacy of this school. You've shown your commitment to population health, as we've heard. 2/3 of the pre-doctoral class volunteered for community outreach events, beyond the mandatory ones. And this is the highest percent for any class to date, I was told. It's very good. And you reflect your commitment to global health and leadership by who you are. The graduating classes represent 30 countries, including the United States. And you're on your way to lifelong learning. 30% are continuing to advanced education. So it's clear to me that you're a class with heart and soul, and a class that can and will make a difference worldwide. And in a few minutes, you'll be off with your diplomas and certificates in hand. But before you go, I'd like to leave you with 3 thoughts. First, health is more than health care. We know that access to health care is important, but when all factors that contribute to health are considered, access to health care only contributes 10%. The other 90% is made of our genetics, our lifestyle behaviors, our environmental exposures, and our social circumstances. So what does this mean for us? It means that we have to use our expertise and knowledge to also address the 90%. It will require addressing social determinants of health, factors that affect health equity, social and environmental justice, housing, wealth, and education. It will require being well-versed in communication skills to support and build health literacy and support healthy behaviors. Simply put, it means giving the science to people in a manner that allows them to use it. It also means efforts should be spent in promoting health, and they're as important as treating disease. A second thought is that quality of care is more than technical excellence. Dentistry prides itself in its technical excellence, as it should, and I know you're well prepared. However, quality of care is more. It includes a focus on patient-centered care, care that is coordinated and managed, care that is equitable and timely, as well as safe and efficient. It is care that includes reaching out to the population in the community, not just to those who present themselves at our offices. It means that we must co-lead with our patients, facilitate care referral with our health care colleagues, focus on essential needs, work with community and professional groups to reach more and do more than any one of us could do alone. So thought one was health is more than health care, and thought two is quality is more than technical excellence. And finally, the last thought I'd like to leave with you is leadership is more than taking charge. Leadership requires keeping an open mind. It requires being prepared. And leadership in health requires serving the public with the skills and expertise we've been given. The Institute of Medicine has defined public health as what we as a society do collectively to assure the conditions in which people can be healthy. And Treadwell and Northridge have referred to oral health as a measure of a just society. Oral health is a measure of a just society. And oral health is not the sole domain of dentistry, but the dental profession holds the conscience of oral health. We are, in essence, the keepers of the flame. And holding the conscience of oral health is a gift given to us by society, a gift that belongs to all, and a gift to be extended to all. So remember, you are leaders, not only in dentistry, but leaders in health and leaders in society. You're the facilitators and creators of innovations for health and wellness for the public's health. Former Surgeon General David Satcher has said, in order to eliminate disparities in health, we need leaders who care enough, know enough, will do enough, and are persistent enough. And I know you will take your leadership roles seriously. You will take them graciously, and you will take them beyond the wildest dreams of your mentors, your faculty, your families, and friends. We're counting on you. I'm counting on you. And I look forward to the time when you come back here after almost 4 decades to speak before the class of 2052. I leave you with several of my grandmother's many, many wise sayings. Listen to and lead with your heart, and take care of your health so you can take care of the health of those around you. So congratulations, graduates. Thank you so much for letting me join you, and I salute you.